Breath from Salt, A Deadly Genetic Disease, A New Era in Science, and the Patients and Families Who Changed Medicine Forever by Bijal P. Trivedi chronicles the journey of cystic fibrosis, CF, patients and their families, exploring how a devastating genetic disease transformed the world of medical science and led to groundbreaking advancements in genetics and treatment. The book focuses on the history of cystic fibrosis, detailing its discovery, the challenges faced by patients, and the scientific and medical breakthroughs that ultimately revolutionized treatment for the disease. The narrative is interwoven with personal stories of patients and their families, highlighting their resilience, determination, and contributions to science. Cystic fibrosis is a life-threatening genetic disorder that causes severe damage to the lungs, digestive system, and other organs. It is caused by mutations in the CFTR gene, which leads to the production of thick, sticky mucus that clogs the airways and causes infections. The disease primarily affects children and young adults, and until recently, most CF patients did not live past their 20s. This book emphasizes the complexity of CF, the difficulty of diagnosing and treating it, and the emotional toll it takes on patients and families. The author takes readers through the early history of cystic fibrosis, when it was first identified in the 1930s. At that time, little was known about the genetic causes of the disease, and treatments were limited. Doctors focused on managing symptoms, but there was no real cure or understanding of the underlying genetics. The book explains how, over time, CF was recognized as a genetic disease and how scientific advances, such as the discovery of the CFTR gene, paved the way for new treatment options. Trivedi delves deeply into the early struggles of cystic fibrosis patients, particularly in the era before the disease was understood at a molecular level. Families were left to fend for themselves with few medical resources, and many children died from the disease at a young age. The emotional impact of losing a child to CF, or caring for one who was severely ill, is a central theme of the book. It highlights the immense challenges faced by parents who were not only caring for their children but also fighting to bring attention to the disease in a world that seemed to have little understanding of it. The narrative then shifts to the scientific breakthroughs that began to reshape the treatment landscape for CF. The discovery of the CFTR gene in the 1980s marked a pivotal moment in the history of cystic fibrosis research. Scientists realized that mutations in this gene were the root cause of the disease, which opened the door for targeted treatments. Trivedi explores the intense scientific collaboration and dedication that led to this discovery, along with the challenges of translating this knowledge into effective therapies. As the understanding of CF deepened, researchers began to focus on developing drugs that could target the CFTR gene itself. Trivedi details the efforts of pharmaceutical companies and researchers who worked tirelessly to create medications that would correct the genetic mutation, not just treat symptoms. The book explores the role of gene therapy and other innovative approaches, including the development of drugs like Kalydeco, which was the first drug to target the underlying cause of CF. The book also highlights the role of patients and their families in the fight against cystic fibrosis. These individuals played a pivotal role in pushing for research, advocating for more funding, and participating in clinical trials. Families who were directly impacted by the disease became passionate advocates for CF research, helping to raise awareness and generate support for groundbreaking clinical trials. Their perseverance and commitment were instrumental in the progress that ultimately led to life-changing treatments. Another significant aspect of the book is the exploration of the ethical and emotional challenges faced by families and medical professionals in the context of CF treatment. With the advent of new therapies, there were difficult decisions to be made about how to treat patients, particularly those who were severely ill or had limited life expectancy. The book touches on the moral dilemmas that arise when dealing with genetic diseases, including the challenges of offering hope when there is no cure. Trivedi also examines the role of the cystic fibrosis community in shaping medical research. The CF Foundation, a non-profit organization dedicated to improving the lives of people with CF, played a critical role in supporting research and funding the development of new treatments. The CF Foundation's unique approach to partnering with pharmaceutical companies and researchers is explored in the book, demonstrating how collaboration between different sectors can lead to significant advancements in science and medicine. Through personal stories, the book brings to light the emotional toll of living with cystic fibrosis. It discusses the psychological impact on both patients and families, highlighting the constant stress and uncertainty that come with managing a chronic illness. The book emphasizes the importance of mental health support for families and caregivers, as they navigate the challenges of living with a life-threatening disease. The author also delves into the social and cultural aspects of cystic fibrosis. Families often faced isolation due to the stigma associated with the disease. There were also issues related to access to healthcare, as CF treatments were expensive and not always available to those in need. The book explores the inequalities in healthcare access and how the CF community worked to address these issues. As the book progresses, it highlights the progress that has been made in treating cystic fibrosis, but it also acknowledges that the disease is far from being fully cured. While patients today can live longer, healthier lives thanks to advancements in treatment, many still face significant challenges, including the need for lifelong medical care and the ongoing quest for a cure. Trivedi ends the book by reflecting on the progress made and the work that remains to be done in the fight against CF. In addition to the scientific breakthroughs, Breath from Salt also offers a glimpse into the personal lives of CF patients and their families. The stories of individuals who have battled the disease, some of whom have become advocates or researchers themselves, are woven throughout the narrative. These personal accounts provide an intimate look at the resilience and determination of people living with cystic fibrosis, offering hope and inspiration to others facing similar struggles. The book concludes with a hopeful message about the future of cystic fibrosis treatment and the ongoing research that holds the promise of a cure. While the disease remains a major challenge, there is optimism that continued scientific advancements and collaboration will ultimately lead to better treatments and, eventually, a cure. Trivedi's work serves as both a tribute to those who have fought against cystic fibrosis and a call to action for continued research and support for the CF community. Ultimately, Breath from Salt is a powerful testament to the power of science, community, and perseverance in the face of a devastating genetic disease. Through the lens of cystic fibrosis, the book illustrates how patients, families, researchers, and healthcare professionals have come together to change the course of medicine and improve the lives of countless individuals. The fight against cystic fibrosis is far from over, but the progress made thus far is a testament to the strength of the human spirit and the potential of scientific innovation.